Hello, everyone. My name is Snehal Desai. I'm going to be doing a question answer review session in a moment. Um, so I'm just going to wait for a few of you to join us, and then we'll get started here. Uh, so, just want to let anyone know that's on our live stream today, just to see if anyone had any questions. Um, be getting started relatively quickly here in a little bit. So, for those who are not able to join us right now, that is all right. Um, as you're not going to really miss anything, it's just a quick question answer review for um, mainly from the or based off the NAPLEX review group page, um, where all these questions were posted. So we will go over this um, so you all can get a little feel of some tips or any advice or anything that will help in answering questions when it comes to the real exam. Now, these are just a few questions that you may or may not see in practice setting, but at least you all should be able to answer these very basic knowledge-based questions, um, as you would see in like the blueprint. Couple of these fall in line of like consultations, mechanisms, classes, drug classes specifically, drug, names, brand names, and all. So take all that into account and learn all those concepts before answering these types of questions. Make sure you all are prepared for it. Now, I will be putting together some videos to assist with your studying as you go through the NAPLEX review materials and other resources that you use to study for this exam. Now, it's the questions aren't going to be exactly like how I posted, you know, how we have posted on the pharmacy group page on our NAPLEX review group page. They're going to be a little more lengthier. They might be a little bit twisted. They might be a little bit tricky. So we're going to look at some main key concepts to help you answer those questions correctly and quickly. So you don't fall behind on the test and that you're able to answer them before running out of time, and you're able to pass the exam at the end. So I'm going to show you a couple of tips, and that will help improve your skills in knowledge, and also helping our patients, helping our coworkers and others understanding, the reasoning as to the importance of the medications and why they're important in the human body, what the mechanism is, how it's going to help overall. And so we will look at all of this. Now, there's a couple of things. I've seen a couple of you already answer these questions, and some of you have some extra or need some extra practice so that you guys can do well. So we're going to have more repetitive, I don't like repetitive, or maybe more of a repeat type of content information for you all, so you guys can reinforce some concepts that you already studied one time, but maybe looking at it another way. So I hope that helps you all. And I'm sure you already saw the posting on our farm insurance group page that how we are still or we are in process of making a few changes to this YouTube channel to make it a little bit accessible and easier for you all, so you guys can navigate through the content more easily and get the most effective information out of it. We don't want you all to feel overwhelmed, so we have broken up playlists to make the content navigation easier. We're going to condense some of the information or some of the playlists to make it a little bit easier so it's not overwhelming. So some of the new drug information that you probably haven't seen or heard of, we'll probably leave that in a separate playlist for you all, just for your future reference. Information that's typically not going beyond the exam, so we're not going to be combining all that into one for you all, because we feel that it's not going to be helpful material, especially for those who are studying for NAPLEX, but it will be helpful for those who are currently in practice as a pharmacist or who are licensed pharmacists already in practice. So we're going to have those playlists separated out for you all so you all can browse through it easily. I also want to mention we are looking into starting a reward system. However, we haven't really fully developed it yet for you all, or actually, initiated it yet. But it is coming soon, and we want to thank you all for joining our farm insurance community, because we have put in a lot of work for you all, and we appreciate you all at least taking the time to utilize our resources. We hope that it has been somewhat helpful to you all, and we think it will. We can continue to make this grow. So as we continue to grow, you guys will also receive some perks, um, from this as well. So we want to make sure that we make this a educational but also an enjoyable and pleasant experience for you all. So we just want to thank you for all your hard work and um, you know studying really hard, and you know at least participating in the events that we have posted for you all. So in all of that, let's take a look at the NAPLEX review group questions and answers here. So as you can see, these are some of the questions here. First one asks, which of the following is another name for vitamin D3? There is actually a trick to this one, and some of you might know it, some of you might not. But it's not just about the trick, but when you look at a medication, you should know everything about it. And so, everything is at least knowing what the brand generic name is, what is the indication, what is the mechanism, what is, what it is exactly. So, vitamin D3, it's very essential vitamin. It's one of the most essential vitamins everyone needs. You get it from sunlight, you get it from, certain foods. Vitamin D3 is also, or vitamin D in general, come from different forms. There's a plant-based, there's a plant-based vitamin D, and then there's a naturally produced vitamin D. So, knowing the difference between D3 and also D2 is important too. So you can see here that we're talking about vitamin D3. Now, vitamin D3 actually comes in a different name as the vitamin D2. The vitamin D3, hence the part of the name D3. It's if you take the D and go, I guess you can think of it different ways, but D3, you will think of the number 3 as 3 C's in the name of the brand name. So cholecalciferol is going to be another name for vitamin D3 because it has 3 C's in the name. If it's vitamin D2, it'll have 2 in the name, so 2 C's. calciferol is going to be two C's. So, note those differences here. Which antibiotic is a beta-lactam antibiotic type? So there's different types of beta-lactams. You have a penicillin, VK, you got the amoxicillin, augmentin, those are all going to be beta-lactam type of antibiotics. There's other types as well. I just named a few. Definitely know the classifications. That is a very easy part of the test, so you guys should be able to understand that. Same thing for first one. It's more like a classification type of question. And then the third thing is regarding a counseling point, so consultation. When taking metronidazole, what is an important counseling point? Now, there could be different counseling points on the exam. They might ask you which of the following is true. Obviously, there are other important counseling points for metronidazole. So make sure you choose all of those answers as well. But the most important, if there was a multiple choice question here, is, one of them was definitely avoiding alcohol while on metronidazole. And so make sure you understand that as an important or standing out counseling point, and letting your patients know that, to avoid alcohol while on metronidazole. The next one here is regarding macrobid and its indication. So indication is another part of the blueprint. So understand the indication of the medications as well. So macrobid is used for typically urinary tract infection, UTIs. Same thing for, indication for this next question. Which medication is used to treat hiccups? This is going to be a little bit tricky for some of you, but you might see this as a patient case, more like a straight question or a straight question. But typically, theoretically, it's shown that haloperidol is actually shown to help treat hiccups, specifically persistent hiccups. So, that's if the medication haloperidol is in there and you see hiccups, you just think of the two H's here: hiccups, haloperidol, and at least you'll get that much of that question right. So just note that. The next one regards the naming of the medication, the brand generic name for medication. So here, I was just asking, like, what is the brand name for fluticasone salmeterol? And so you know that this medication, just by the generic names alone, you can see one is a steroid inhaler, and the other one is like a bronchodilator, so salmeterol. So note that because it's a combination drug, you need to know the brand name as well. And the brand name for this one is Advair. So make sure you know about that. Also note that when you're counseling patient, let them know because of the steroid or the corticosteroids that is contained within these types of inhalers, to make sure they rinse their mouth due to the risk of getting thrushed. So, just a side note there, so some of you all can let your patients know about that as well. But the next question, I know some of you were confused. I saw a couple of you answer this question in multiple ways. So this question could trick some people up. So this um, was very interesting to me about Entresto. Entresto is essentially like a uh, cardiovascular, heart, blood pressure type of medication. You might see it in practice, um, but I do want you to be careful though whenever you're in the practice. Patients on Entresto, they shouldn't be taking an ACE or ARB while they're taking Entresto, okay? And definitely not an ARB because it's going to be a duplication. So, but there's a special condition though, when switching from Entresto to an ACE inhibitor or from an ACE inhibitor to Entresto. And that is that you have to wait 36 hours, or there's a 36-hour washout period switching from and to Entresto. So, if a patient's taking an ACE inhibitor, um, and then they want to go to Entresto, they have to go through the 36-hour washout period. And if they're going to go from Entresto through an ACE inhibitor, they have to do the same 36-hour washout period. So just note that. The next question is, and this could be a question on the NAPLEX too, so just wanted to put it out there for you all. So hopefully that helps you remember that it goes both ways, from ACE to Entresto, or from ACE inhibitor to Entresto, or Entresto to an ACE inhibitor. And then the next one here is about the thyroid hormone. Now, thyroid hormones come in two different ways. There's a T4 and T3. So in this case, when you're talking about active form, T4 is actually the pro hormone, kind of like a pro drug. So T3 is going to be the active form. So wanted to let you all know about that as well. So if anyone has any more questions on that, just feel free to let us know. The next one here is about an SGLT2 inhibitor. There are different kinds, and you should know all of these kinds, like Farxiga, Jardiance, Invokana. So knowing these different brand names is you should know, as well as the generic like dapagliflozin, pegliflozin, canagliflozin. Just by name alone, you can see that it's something's going to be flowing or flowing. Flowing, I guess you can think of gliflozin, glucose flowing through, the renal part and get flushed out through the urine as like glucose coming out. So similarly, that's kind of like the mechanism here, so you guys can kind of picture it out here. Hopefully that helps you out. Then the last question is, which of following classifies Xanaflex? This one is another classification, but it's got to be pharmacologically based mechanism as well. So make sure you understand multiple concepts on this last question here, because it might not be just one bullet point on the blueprint. They could pull a question that fits into two or three different bullet points. So this question kind of goes in both ways. You already know Xenophax as a muscle relaxer. They might have multiple selections here. So muscle relaxer, you know that it can help with reducing blood pressure, as it can also reduce blood pressure as well, as like a side effect. So the other part is the pharmacology part of it, or the mechanism. It is also, they might also list out, is it beta 1 agonist, is it beta 2 agonist, beta 3 blocker, alpha 1 blocker, alpha 2 blocker. And so in this case, it's actually an alpha 2 agonist. So make sure you understand that as classification of NAPLEX. Um, this is a type of question that, though it's simple now, but when you sit on the exam, they may ask you to select more than one answer to this type of question. So make sure you know about that. So these are all the answers here listed for your reference. And these are some tips. So see the drugs in a matter of helping someone and how they work. Just like I mentioned earlier, it's always important to not just telling the patient, hey, this is going to help you with this, but telling them how it will help. Okay. You don't have to go into specifics on the mechanism and anything or anything like that, but at least letting them know that this is a medication that we'll use to treat this, um, and that it's going to work in a way that, to prevent further complication. It doesn't have to be exactly at these timelines, but at least you can help a patient. If you tell the patient a little bit more about the medication, if they ask you, what do I need to know about this medication? You can talk about things like, hey, there's a chance that it might lead to this kind of side effect. If it's taken this way, or if it's taken with this medication. Um, and you could also be explaining to them a little bit about the processes. It doesn't have to be very specific. Don't go into like medical terminology type of stuff, but like medication might help open up the breathing of the airway flowing through your lungs, things like that. So explaining a little bit more to the patient and helping them understand how that medication works will go a long way. And, along with explaining, why food is necessary with certain medications like antibiotics. Why should patient be taking food? Don't just tell them, yeah, be sure to take it with food, but you have to complete it. Ask them, tell them why, they should be taking it with food. Like it might upset your stomach. Um, that's the most common way that patients should be taking that medication with food, specifically antibiotics. So just just quick tips. And then also understand the brand generics. Make sure you know the brand generics of these medications. So sometimes patients don't understand the drugs in the generic name. So you would just have to tell them the brand, because that's probably how their doctor explained it to them, or that's probably how they heard it from other people or other ways. So you would just need to know that. Also look for key ways to remember certain concepts. Like I said, for D3, 3Cs, and the name cholecalciferol, you can see the 3Cs there. You can see 2Cs in the ergocalciferol. Those key ways to remember the drugs, it's going to help a lot. And then definitely reviewing concepts, um, and knowing the activity of different types of receptors. Many times, the knowledge on these receptors is going to help a lot. So, like thyroid receptor, beta receptor, alpha receptor, serotonin receptor, dopamine receptor. Then there's like other types of receptors. It's important to know all of that, or at least have some basic knowledge um, when you're connecting that medication to it, because these medications are going to go somewhere. They have to bind somewhere, and so at least having that kind of knowledge on the receptor is going to help. And also keep practicing questions. Um, Study with others. Take advantage of our videos on our Farm Beds group page. Use the UWorld ebooks um, and their questions as well. It is very useful. All of the resources that we provide and the NAPLEX resources that you utilize. If you use them, differently, if you use this resource and another resource and combine those, you're going to see how much more you'll know before you take this test. Because concepts that I am providing in these videos and the concepts you're pricing in the books, they're going to overlap and you're going to get a lot of that reinforcing knowledge. So kind of help with it. So hopefully that's it. So that's all for today. Thank you for participating, and have a great day. Thanks.